Welcome to a deep dive into the world of interviewing and diagnostic exercises. So you're looking to sharpen your clinical and counseling skills. We've got a great guide for you today. It's Pearl S. Berman's work.
Berman brings so much experience to this. She's from Indiana University of Pennsylvania. And what's really cool is she uses 20 client profiles to show us how this all works.
Oh, wow, 20.
Yeah, 10 adults, 10 children, and teenagers.
So we're not just talking theory here, we're actually seeing these techniques play out in real-world situations. Now, I'm guessing you probably already know this, but this deep dive isn't going to make you an expert overnight.
Of course not, but it will give you some super valuable insights into interviewing and diagnostics. It's about laying a solid foundation.
Right.
And one of the first things Berman really emphasizes is the interviewer's role, specifically something called role induction.
Okay, role induction. I'm picturing like some kind of formal ceremony. What exactly does that involve?
Well, it's not quite as elaborate as it sounds. It's really about setting the stage for a trusting relationship by being transparent.
Yeah.
The interviewer clearly explains their role, how the clinic works, the ins and outs of supervision, and the boundaries of confidentiality.
So it's about laying everything out on the table right from the start, no surprises, no hidden agendas.
Exactly. Berman points out that this open communication actually leads to better treatment outcomes.
Yeah.
It's all about establishing trust right from the get-go.
Makes sense. Now let's dive into some of those specific interviewing techniques.
Okay.
Berman covers quite a few. And one of the first she discusses is the difference between open-ended and closed questions.
Yeah, you're probably already pretty familiar with closed questions, those yes or no types. They can be useful for gathering specific facts, sure, but open-ended questions are the real game changers when it comes to encouraging a client to explore more deeply.
She gives a great example with G, the Taiwanese student struggling academically. Instead of asking, "Do you drink alcohol?" the interviewer asks, "Tell me about the role alcohol plays in your life."
It's such a subtle shift,
Right.
but it completely changes the dynamic of the conversation, doesn't it? It invites G to actually share his experiences and perspectives rather than just shutting things down with a simple yes or no.
It's like opening a door instead of just peeking through a keyhole. You get a much broader view of the situation that way.
Exactly. Now, building on that idea of opening up the conversation, let's talk about reflective listening.
I'm trying to picture how reflective listening works in practice. Is it literally just repeating the client's words back to them, or is there more to it?
It's definitely more than just parroting.
Okay.
It's about reflecting back not just the words, but the underlying thoughts and feelings. It's a way of saying to the client, I hear you, I'm really trying to understand you.
So you're acknowledging their emotional state as well as their words. I can see how that would build rapport and encourage them to open up even further.
Right. Berman gives a really compelling example with Brenda, a mother who's struggling despite having, a really supportive husband.
Right. Brenda says, "I have a great husband, but I just don't feel close to him."
And the interviewer reflects this back, saying something like, it sounds like you're feeling a real disconnect with your husband, even though you appreciate his support. This highlights those really complex emotions that Brenda's grappling with.
Yeah.
And it validates her feelings.
Okay, so we've seen how open-ended questions and reflective listening can really encourage client to share more openly.
Yeah.
But what about those times when their words don't tell the whole story?
That's where paying attention to nonverbal behavior comes in. Those nonverbal cues can offer some really valuable insights into what a client might not be saying out loud.
She uses that example of Sarah, who's caring for her husband with Alzheimer's. When Sarah's describing her husband's fall, the interviewer notices her clenched fists.
Right.
And that observation is key.
It's not about jumping to conclusions,
Like,
but simply acknowledging those unspoken feelings. By commenting on Sarah's clenched fists, the interviewer might say something like, I noticed you were clenching your fists when you talked about your husband's fall. It seems like that was a very difficult moment for you.
yeah, that makes sense. It's like saying, "I see your pain, even if you haven't put it into words yet." So you're creating a safe space for them to explore those emotions if they're ready.
Exactly. And that leads us to empathetic comments, which take reflective listening one step further.
Okay, so if reflective listening is about mirroring back their emotions, what exactly do empathetic comments add to the mix?
It's about going beyond simply reflecting and actively connecting with the emotions behind the words. For instance, if a client describes anxiety after a car accident, the interviewer might respond with, it's completely understandable that you'd feel anxious after going through such a terrifying experience.
So it's not just you feel anxious, it's more like, I get why you'd feel that way given what you've been through.
Exactly. It's about validating the client's feelings within the context of their experience.
Hmm.
So empathetic comments really help us connect on a deeper level. And once we've established that connection, summarizing becomes a powerful tool for both clarifying and highlighting key themes.
I can definitely see how summarizing would be helpful for showing you've been listening and making sure you're both on the same page.
Absolutely. That's like taking stock of where you are in the conversation.
Yeah.
But summarizing can also be used strategically to highlight recurring themes in a client's narrative. Remember Lisa, who's trying to juggle family life and going back to school?
Yes, I remember Lisa. She seemed to be wrestling with those feelings of inadequacy in both areas of her life.
Right. By summarizing Lisa's feelings of not belonging at home or at school, the interviewer could say, "You've mentioned feeling like you don't quite fit in, both at home and at school. It sounds like you're feeling pulled in different directions and struggling to find a sense of belonging." This helps Lisa see the connection between these seemingly very disparate experiences, potentially leading to a deeper understanding of her anxieties.
It's like helping her see the forest for the trees. Sometimes we're so caught up in our individual experiences that we miss the bigger picture.
Exactly. And sometimes we need a little help staying on topic or shifting gears in the conversation. That's where redirecting comes in.
Redirecting, that sounds a bit like gently steering a ship back on course.
That's a great analogy. Imagine Sarah, who we talked about earlier, constantly focusing on her husband's needs while kind of neglecting her own well-being. A skilled interviewer would recognize this pattern and gently redirect the conversation, prompting Sarah to acknowledge her own challenges.
That's a classic caregiver trap. It's so easy to lose yourself in the process of caring for others.
It is. And redirecting can really help bring those hidden needs to the surface. It might sound something like, "While it's admirable how much you're doing for your husband, I'm also concerned about your well-being. Let's take a few minutes to talk about your needs and how you're coping with the demands of caregiving."
It's about being a guide, not a dictator.
Hmm.
You're respectfully nudging the conversation in a more productive direction.
Exactly. And sometimes being a guide means addressing difficult topics head-on. That's where supportive confrontation comes into play.
That sounds like a tricky balancing act. How do you confront a potentially sensitive issue while still being supportive?
It's about addressing problematic behaviors while affirming the client's feelings. Think of it as holding up a mirror, but in a way that invites reflection, not shame.
Berman uses the example of Gary, who's struggling with substance abuse and aggression. It's not about telling Gary he's a bad person, right?
Right. Right. It's about helping him see the connection between his drug use and his relationship struggles, without making him feel judged or condemned. You might say something like, "Gary, I know you're going through a lot right now, and I hear the pain and frustration in your voice. I also want to help you understand how your drug use might be contributing to the challenges you're facing in your relationships."
It's about helping him gain insight into his own behavior and its consequences.
You got it. It's a delicate technique, but it's a crucial one for helping clients move towards positive change.
Hmm.
And as we delve deeper into these client profiles, you'll see how these techniques play out in really diverse and complex ways.
It's amazing how much nuance goes into effective interviewing. It's really making me think about how I approach these conversations.
It's a continuous learning process.
Yeah.
And one of the things that makes Berman's book so valuable is that it acknowledges the realities of cultural differences in the therapeutic process.
That's so important. We can't approach every client with the same cookie-cutter approach.
Absolutely. For example, in G's case, we see how cultural discomfort with discussing emotions might influence the interview.
Right. In some cultures, it might be considered inappropriate or even disrespectful to openly express certain emotions. It's important to be aware of those cultural nuances.
Exactly. And then we have Raul, who's grappling with mistrust stemming from prejudice against Mexican Americans.
His case really highlights how systemic issues can impact a client's willingness to trust and open up.
It's so crucial to be sensitive, to be aware of those systemic factors, and to create a space where the client feels safe and respected, regardless of their background.
It's about honoring their experiences and acknowledging the ways in which those experiences might shape their interactions with the therapeutic process.
Precisely. And it's not just about ethnicity. Berman also explores how religious beliefs can impact a client's experience. Think about Mary, who's struggling to grieve after her husband's death. Her cultural and religious beliefs emphasize self-sufficiency and emotional control, which might make it really difficult for her to ask for the help she needs.
It's like there are all these invisible layers influencing how a client interacts with therapy.
Exactly. And that's why Berman's emphasis on understanding and respecting diversity is so crucial. It's not just about being uh, politically correct. It's about being an effective and compassionate therapist,
Hmm.
really understanding people.
I'm really starting to see how all these pieces fit together. It's like a puzzle where each technique, each insight into the client's world helps us build a clearer picture.
That's a fantastic way to put it. It's about being a detective, piecing together clues to understand the whole person, not just their symptoms. Now, you mentioned earlier that Berman's book also includes diagnostic exercises. I'm curious to hear more about how those work.
I'm glad you brought that up. I was wondering if they were just about slapping a label on a client or if there was more to it than that.
What's fascinating about these exercises is that they go beyond simply categorizing clients with a diagnosis.
Hmm.
They actually provide a framework for understanding the complexities of human experience using, established criteria as a starting point.
So it's not just about checking boxes.
Not at all. It's about using diagnostic criteria as a tool for deeper understanding. For example, in G's case, we see how the interviewer might analyze whether he meets the criteria for an access to second diagnosis, which focuses on personality disorders.
That seems like a particularly tricky area to navigate.
It can be. And that's why Berman provides these exercises to help clinicians develop those skills to make accurate and nuanced diagnoses.
You might be wondering how to approach these exercises without feeling totally overwhelmed.
Yeah.
Berman actually provides step-by-step guidance walking you through the process of analyzing each client's case and considering potential diagnoses.
It's like learning to use a map.
Mm-hmm.
You need to understand the symbols and the terrain to find your way.
Right.
And just like a map, a diagnosis isn't about limiting our understanding. It's about guiding us towards better support and treatment. Now, Berman doesn't shy away from the tough stuff. The book also covers special interviewing challenges, right?
That's right. She tackles issues like dealing with aggression, navigating cultural differences, understanding the complexities of psychosis, and addressing substance abuse.
She gives the example of Gary, who we talked about earlier. His case involves substance abuse, aggression, and potentially intermittent explosive disorder. That sounds pretty intense.
It can be. But Berman provides some valuable insights into how to handle such situations, such as using empathetic comments to de-escalate a potentially volatile interaction. You might be wondering how to use this technique effectively without sounding accusatory. Berman suggests focusing on specific observations and using I statements to express your concern.
It's like having a toolkit for navigating tricky terrain.
Right.
And those tools are essential for any clinician who wants to effectively support and treat clients facing those challenging situations.
I'm already starting to see how much goes into effective interviewing and how much I still have to learn.
It's a journey. And Berman's book is a fantastic guide. It's packed with insights and practical advice that can really help you develop your skills and deepen your understanding of this complex and rewarding field.
This has been an incredible overview. I feel like we've only just scratched the surface of what Berman's book has to offer.
We've definitely laid a solid foundation. And as we dive deeper into those client profiles, you'll see how all these concepts come to life in vivid detail.
I'm excited to continue this journey, but for now, let's take a moment to absorb what we've learned so far. What stood out most to you?
What's really striking me is how Berman emphasizes the interviewer's role as a guide, not an expert.
Right.
It's not about imposing your views on the client,
Right.
but rather facilitating that self-discovery.
That really resonates with me, too. And speaking of those individual journeys, I keep thinking about G and all the pressure he's under. We talked about his cultural background, but there's also that whole dynamic of him being the golden child, the fifth generation expected to uphold the family business.
It's a huge amount of pressure,
Mm-hmm.
and it's likely intertwined with his academic struggles. The book even mentions him experiencing those physical symptoms, like stomach problems,
Right.
just adding another layer to the puzzle.
It's like his body is screaming out, too.
And speaking of intense emotions, we can't forget Brenda, the mom who feels so isolated despite having what looks like a perfect life on paper.
Her situation really highlights the power of reflective listening to untangle those really conflicting emotions.
Right.
She loves her husband, she cherishes her children, and yet she feels profoundly alone.
And that's where those empathetic comments come in, right? To
Yeah.
validate those feelings and let her know that it's okay to feel this way, that
Yeah.
she's not crazy for experiencing these emotions.
Exactly. It's about normalizing those feelings and creating that safe space for her to explore them without judgment.
Right.
It makes me think about Mark, the college student. Still so haunted by that car accident. He's got the logical side down, good grades, clear career goals, but those nightmares, those weekend anxieties, are clearly impacting his well-being. I wonder if exploring exceptions might be helpful in his case. Berman talks about asking about times when Mark isn't experiencing those symptoms.
Right.
What's different about those times? Are there any clues to coping mechanisms he's already using that we could build on?
That's such a valuable insight. It's about empowering the client to recognize their own strengths amidst their struggles. We're not just focusing on the problem, we're looking for solutions within their own experience.
It's a much more strengths-based approach. And speaking of uncovering hidden strengths, I'm reminded of Sarah, so diligently caring for her husband with Alzheimer's. She's so focused on fulfilling her duty that her own needs are getting buried.
It's heartbreaking, and it really emphasizes the need for the interviewer to gently redirect the conversation.
Yeah.
It's about helping Sarah see that self-care isn't selfish, it's essential.
Right.
If she doesn't take care of herself, she won't be able to care for her husband effectively.
It's about recognizing those unspoken needs, the ones that might even be hidden from the client themselves. Now, shifting gears a bit, let's talk about David, the charming salesman whose life is unraveling due to substance abuse.
His case is a prime example of when supportive confrontation might be necessary.
Right.
He's clearly in denial, blaming everything but the drugs for his problems.
That sounds challenging. How do you walk that line between being supportive and actually confronting a behavior the client might be so resistant to acknowledge?
It's about striking that balance. You want to acknowledge their feelings, their perspective, while also gently challenging that denial. Remember, it's not about judgment.
Right.
It's about helping David see the connection between his choices and the consequences. Berman talks about focusing on the facts. Your drug use led to this specific consequence, rather than labeling him as an addict.
It's about giving him the space to own his actions and hopefully make different choices moving forward. And speaking of choices, I keep thinking about Lisa, the mom returning to college and all the guilt and fear she's carrying. She seems to be struggling with that fear of not measuring up in any area of her life.
Her case really highlights how summarizing can be such a powerful tool. By reflecting back those feelings of inadequacy that she's experiencing both at home and at school, the interviewer can help her see a pattern, maybe leading to a deeper understanding of where those anxieties are actually stemming from.
It's about helping her connect those dots, to see that those feelings might have a deeper root cause, not just stemming from those individual situations. Now, thinking about those deeper layers, Aaron's case, with his schizophrenia diagnosis, presents a whole other dimension to the interviewing process.
Absolutely. You're dealing with hallucinations, paranoia, those voices telling him to harm his mother. It's a whole different ballgame.
It sounds so intense. How do you even begin to approach a situation like that?
Well, in a case like Aaron's, assessing the risk of dangerousness becomes paramount.
Right.
You need to understand the severity of his symptoms.
Right.
And the potential risks to himself and others.
Right.
And then there's the challenge of showing empathy without validating the delusions. Berman suggests focusing on Aaron's feelings. I understand why you'd be scared if you believed that, rather than arguing about the reality of the voices.
It's about meeting him where he's at, acknowledging his fear and confusion, while also creating that safe and structured environment.
Yeah.
So we've covered a lot of ground with the adult client profiles. What about the younger clients? I imagine talking to a child or teenager presents a whole other set of challenges.
You're absolutely right. We have to be so mindful of their developmental stage, their limited vocabulary for expressing emotions, and their potential fear or mistrust of adults.
Thinking about Cynthia, the 12-year-old with the eating disorder, I'm struck by how much she seems to be mimicking the behavior she sees around her. Almost like she thinks that's what it takes to fit in.
It's a classic example of how those societal pressures and unattainable beauty standards can really impact young people.
Right.
And it highlights the need for the interviewer to address those underlying beliefs. It's not just about telling her to eat.
Right.
It's about helping her understand that self-worth doesn't come from a number on a scale.
It's about empowering her to challenge those societal messages and to find her own definition of beauty and health. That must be a really delicate conversation to navigate.
It is. It requires a lot of sensitivity and patience. You have to build that trust and rapport, especially with teens like Jeffrey, who's so withdrawn and angry after being teased and rejected.
He seems to be using those video games as an escape from the pain of those experiences.
It's a common coping mechanism, and it makes me think about how crucial nonverbal attending is in those cases.
Right.
Even if he's not saying much, paying attention to his posture, his tone of voice, can give us clues about what he's feeling.
It's like reading between the lines, showing him that we're truly present and listening, even when he's struggling to express himself. And sometimes those struggles are amplified by external circumstances, like in Melissa's case. She's caught in the middle of her parents' divorce and literally feeling sick with worry.
Her stomach aches are a physical manifestation of that emotional turmoil she's going through.
Right.
Children often express their emotional distress through physical symptoms.
It makes me think about how important it is to explain things really clearly to children, especially when their world feels so unpredictable.
Right? Berman talks about tailoring our language to their level, avoiding jargon or complex concepts that might overwhelm them.
So it's about meeting them where they are developmentally, recognizing that their ability to process information might be different from an adult's. That makes a lot of sense. Now I'm curious to hear more about Edward, who seems to be facing multiple challenges. He's struggling with learning disabilities on top of dealing with his mother's cultural differences and his own feelings of inadequacy.
His case is a really powerful reminder that we need to be sensitive to all the layers influencing a child's experience. It's not just about diagnosing a learning disability, it's about understanding the whole child within their unique context. We need to consider his family dynamics, his cultural background, his emotional state, and how all these factors might be contributing to his struggles.
It's about seeing the world through his eyes, recognizing the challenges he faces, and offering support without judgment. And thinking about those systemic challenges, Raul's case really stands out. He's facing prejudice, mistrusting authority figures, and using drugs as a coping mechanism.
His anger is palpable, and it's likely fueled by years of feeling marginalized and misunderstood.
I can only imagine how frustrating and disheartening that must be. How do you even begin to build rapport with someone who's carrying so much hurt and anger?
It's about demonstrating genuine empathy and respect.
Right.
It's about acknowledging the systemic injustices he's faced and creating a space where he feels safe to open up. You might say something like, Raul, I understand that you've had negative experiences with authority figures in the past. I want you to know that I'm here to listen without judgment and to help you in any way I can.
It's about showing him that you're not just another authority figure ready to judge or dismiss him. You're on his side, and you want to understand his experience.
Exactly. Now, shifting gears a bit, let's talk about Erica, who's grappling with grief and guilt after the loss of her parents. Her religious beliefs are intertwined with her understanding of the accident, adding another layer of complexity to her grieving process.
It's heartbreaking to hear her talk about feeling responsible for their deaths, to see a child carrying such a heavy burden.
It really is. And it emphasizes the need to be sensitive to her beliefs, to meet her where she's at emotionally and spiritually. You don't want to dismiss her faith or try to impose your own beliefs on her.
It's about offering comfort without judgment, helping her process her grief in a way that honors her worldview. Now, thinking about those varying worldviews and the unique ways in which children process their experiences, Joseph's case really stands out. He's been through so much trauma, parental abandonment, his grandmother's hospitalization, being placed in foster care. It's no wonder he's acting out, stealing, threatening people.
It's a classic cry for help, a desperate attempt to gain some sense of control in a world that feels chaotic and unsafe.
It makes me think about how crucial it is to address those underlying needs, to help him feel seen and heard, rather than just focusing on the behavioral symptoms. We need to understand the root cause of his pain.
Absolutely. It's about recognizing that those behaviors are a form of communication, a way of expressing his pain and fear. You might say something like, Joseph, I can see that you're hurting, and I want to understand what's going on. I know you've been through a lot, and it's okay to feel angry or scared. I'm here to listen and to help you find ways to cope with those feelings.
It's like peeling back the layers of an onion, trying to understand the root cause of his actions, rather than just reacting to that surface behavior. That's such a powerful way to approach these challenging situations.
It is. And it reminds me of Alex, who's also experienced significant loss and is now struggling to adjust to a new family dynamic. He's walking on eggshells, terrified of making mistakes, worried that his stepmother doesn't love him and that he'll be sent away.
It sounds like he's carrying a lot of fear and insecurity. I can only imagine how difficult that transition must be for him.
It's crucial to create a safe space for him to express those fears,
Right?
to reassure him that his feelings are valid,
Mm-hmm.
and that he's not alone in this transition. You might say something like, Alex, it's understandable that you're feeling a bit nervous about all the changes happening in your family. It's okay to feel that way. I want you to know that I'm here for you and I am here to listen to whatever you want to share.
It's about helping him find his voice, to advocate for his needs, and to navigate those complex family relationships with more confidence.
Exactly. And it's a good reminder that interviewing, especially with children who have experienced trauma, requires patience, empathy, and a deep understanding of the impact of those experiences on their development. We can't just expect them to get over it or to behave in ways that don't reflect the pain they've endured.
That brings to mind Sabina's case. She's made some difficult choices, rebelling against her family's cultural expectations, and now she's facing the consequences.
Her situation really highlights the importance of exploring those acculturation issues, understanding the tension between her desire for independence and her family's traditional values. She's caught between two worlds, trying to figure out who she is and where she belongs.
I can see how that would be such a confusing and isolating experience. It's like she's trying to reconcile two different identities, and it's creating a lot of inner conflict.
It is. And it makes me think about how crucial it is to avoid judgment in these situations. It's not about taking sides, but rather helping her process her experiences and make choices that align with her values, even if those choices deviate from our family's expectations.
It's about empowering her to find her own path, even if it's a difficult one. It's about supporting her journey of self-discovery, even if it means challenging cultural norms.
Exactly. And that requires building a trusting relationship, one where she feels safe to be vulnerable, to share her doubts and fears without feeling condemned. You might say something like, Sabina, I can see that you're going through a lot right now. I want you to know that I'm here to listen without judgment and to help you figure out what's best for you, even if it means making difficult choices.
Kathy's case is a stark reminder of the importance of that trust, especially when you're dealing with trauma. She's been sexually abused by multiple men, and now she's terrified of repeating those patterns.
Her story is heartbreaking, and it highlights the need to be incredibly sensitive to the impact of trauma on a child's development. She might be hesitant to open up, to trust adults, and that's completely understandable.
It's about creating a space where she feels safe to share her story at her own pace, without feeling pressured or judged. How do you even begin to approach such a sensitive topic with a child who's been through so much?
It's about starting where she's at
Mm-hmm.
and following her lead. You might say something like, Kathy, I know that some things are hard to talk about, and it's okay if you don't want to share everything right now. I'm here to listen whenever you're ready, and I want you to know that you're safe here.
Mm-hmm.
You really want to convey a sense of unconditional support and acceptance. Let her know that she's not alone.
It's about offering a safe haven, a place where she can begin to heal and to rebuild her trust in herself and others. This has been such a powerful exploration of Berman's work. I feel like I've gained a deeper understanding not only of interviewing techniques, but also of the complexities of human experience.
It really has been an eye-opening journey. Each client profile, each challenge we've discussed, has highlighted the importance of empathy, active listening, and that ability to tailor our approach to meet the unique needs of every individual.
I'm especially struck by Berman's emphasis on the interviewer as a guide, not an expert. It's not about imposing solutions, but rather empowering the client to discover their own strengths and to make choices that align with their values.
That's a profound insight. And it reminds me of one of Berman's key points that we haven't explicitly discussed, the importance of recognizing and managing power dynamics in the interview.
Power dynamics. I'm curious to hear more about that. It seems like a subtle but potentially so important aspect of the therapeutic relationship.
It is, you
Yeah.
know. Think about it. The interviewer, by nature of their role, holds a certain level of power.
Right.
They're seen as the expert, the one with the knowledge and the tools to help.
Right.
But that power dynamic can really influence a client's responses, their willingness to be vulnerable and honest. They might feel pressured to say what they think the interviewer wants to hear, even if it's not the whole truth.
So even with all the techniques we've discussed, like those open-ended questions and reflective listening, that inherent power dynamic can still create a barrier to truly open communication.
Exactly. And Berman stresses the importance of being mindful of that hierarchy, of creating a space where the client feels empowered, not intimidated.
Right.
It's about recognizing that the client is the expert on their own experience And our role is to help them understand and navigate that experience more effectively.
So it's not just about the words we use or the techniques we employ, it's about the entire atmosphere we create, the way we position ourselves in relation to the client. It's about fostering a sense of collaboration and mutual respect.
Precisely. It's not about fixing the client. It's about walking alongside them on their journey of self-discovery and healing.
That's a beautiful way to put it. It's a much more empowering and collaborative approach. Now, thinking about those power dynamics, I'm wondering how they might show up differently with children and teenagers, especially those who have experienced trauma or who are dealing with, difficult family situations.
That's a great question. Children, especially those who've been abused or neglected, are often very used to adults having all the power. They might be really hesitant to speak up, to assert their needs, or to challenge authority. It's just so crucial to be extra mindful of those power dynamics
Mm.
and to create a space where they feel safe to express themselves freely without that fear of judgment or reprisal.
It's about leveling the playing field, so to speak, and creating a sense of partnership.
Exactly. It's about letting them know that their voice matters and that they have a right to be heard.
This deep dive has given me so much to think about. I feel like I've gained a whole new perspective on the therapeutic process. It's not just about techniques and diagnoses, it's about human connection, empathy, and empowerment.
It really has been an incredible journey. And as we wrap up this deep dive, I want to leave our listener with one final thought. It's a thought inspired by Berman's work, but it really extends beyond the realm of therapy.
I'm all ears.
Power dynamics exist everywhere,
Yeah.
not just in the therapy room.
Right.
They're present in our families, our workplaces, our communities. And as we become more attuned to those dynamics, as we learn to recognize and manage them effectively, we can create much more equitable and empowering relationships, both for ourselves and for those around us.
That's such a powerful message to end on. It's a call to action, an invitation to become more conscious and intentional in our interactions, to create a world where everyone feels seen, heard, and empowered.
Beautifully said. And to our listener, thank you for joining us on this deep dive. We hope it sparked your curiosity, expanded your understanding, and inspired you to continue exploring those complexities of human connection.